During the pandemic, travel nurses have moved to some of the hardest hit communities to fight COVID-19. And one nurse from our area spoke to us about her experience on the Navajo Nation. Here's Grace McKenna.
In July, Chattanooga-based travel nurse Taylor Oakes arrived on the Navajo Nation to help stop the spread of COVID-19.
It was a really dire situation.
At the time, the nation had the highest per capita infection rate in the country. Last week, they began a new round of stay-at-home orders as cases neared 25,000 and deaths topped 800.
I haven't come across a family that hasn't lost at least one family member, sometimes multiple. So a lot of times when we call people to tell them you tested positive for COVID, they're very emotional.
Oakes works 12 hours a day, 6 days a week, treating and educating patients. She says in the Navajo community and other marginalized communities, the virus is having an outsized impact. But in 6 months, that dire situation she traveled to hasn't improved.
It's a lot more stressful. I've been here a while now, and I thought things were going to get better, and things have only gotten significantly worse.
One thing, though, has changed. Since she arrived, lines have shifted.
Nurses are commonly referred to as the front line, but now the way the virus has spread, it's kind of on all of us to contain the spread.
As Oakes prepares to come home at the end of her contract, travel nurses are the last defense for communities that need them now more than ever. Reporting in Chattanooga, Grace McKenna, Channel 3 Eyewitness News.
Now, when Oak's contract ends, she'll return to her former job as a pediatric cancer nurse. The Navajo Nation is under a 2-week shelter-in-place lockdown effective until next Monday.